AI has a huge potential in infectious diseases. Other specialties, like for example, critical care and radiology, have really, jumped into integrating like artificial intelligence into their workflows and automating a lot of what they do and some of their redundant tasks. Um, why infectious diseases is kind of like further behind? It's really hard to answer that question. From talking with some of my colleagues, there's a lot of like clinical complexity and nuances with infectious diseases that may not be well positioned for AI in its current state. But I also think a lot of it also stems from a lot of infectious diseases providers don't have formal training or knowledge in, for example, clinical informatics, machine learning, and other AI technologies as well too. I do think that infectious diseases is a specialty that's well poised for integrating AI into our, workflows as well. We wear a lot of hats in the hospital too. Aside from just seeing patients in the clinic or, as, inpatient consultations, we also are antimicrobial stewardship or infection prevention control. We do transplant medicine, and we also work with our public health colleagues as well. And a lot of those tasks that we do are, redundant, or there's an algorithm or some type of like workflow that we follow. And that's where AI can really step in and help reduce some of those redundant cases because it allows us to actually focus on some of the more complex cases and the one that needs our attention or the ones that really need input from an infectious diseases physician. I think one of the biggest misconceptions is that AI is going to replace healthcare workers. And I think a lot of that just comes with the naming of it, which is artificial intelligence. I think of AI as augmented intelligence, not artificial intelligence. It's a way to extend what we do, automate our routine workflows, and really extend our reach as what we can do as specialists or even, as pediatricians. One of the things that I personally use in my clinic like nearly every day, and I think is widely available to most physicians nowadays, is the use of ambient listening technology. What essentially ambient listening technology is it's a speech to text software that takes what we're saying and translates it and summarizes it into the notes. That allows me to sit down, actually talk with the patient and have a conversation rather than focusing on, entry into the computer, whether it's taking notes for the patient, going through their medications, and so on and so forth. Another tool that I like to use is a medical AI platform that essentially is a large language model built on medical literature and guidelines. What this lets me do is I can type in a prompt or a question about my patient, and it'll perform a literature review across hundreds of papers, matching it to the age range, the clinical questionnaire criteria, and even more like nuances, for example, the patient's net immune state. And then it actually allows me to kind of look underneath the black box and shows me its work and process too. So it can actually show me the exact papers that it's pulling, in line by line when it's answering the question. I can hover over it and essentially look at the like literature in real time too. So I can see, where the answer is coming from, verify the source, and allows me to decide if I'm going to use that information to make a decision with a patient.